So joining us live tonight to talk a little bit more about this ongoing health threat, which we've been talking now for the past few weeks, is Olivia Kasiri. She's with the Sacramento County Health Department. Thanks so much for being in and talking to us about this. This is getting serious.
It is very serious, yes. It started about a week and a half ago, and up to now we have 42 cases reported to us.
This seems like it's come out of nowhere. Is there anything that you can track back to figure out where this started, where these pills are being manufactured?
We have no idea. We do know that an investigation is taking place with the Drug Enforcement Agency and the Sheriff's Office, and they're trying to track where the pills are coming from.
Do you know anything about that investigation at this point? Is it a criminal investigation or?
It's a separate investigation, so I don't have the details on that.
So talk a little bit about this. So we know that people have died, they've overdosed. Where are they getting these drugs? Just on the streets?
People are telling us, some of them are saying they bought them off the street, others are saying they got them from friends or neighbors or relatives, so it varies. But I guess the common thing is that they're not getting them from a pharmacy.
So if you are taking a hydrocodone or a Norco or something from your doctor, if you're watching, you should feel safe that those pills are okay.
If they're from a pharmacy, those are safe. But what we have found is the ones that people are buying off the street, they don't know what they're getting. Many of them are actually fake pills.
So do you know anything about these pills? I mean, it's amazing when we've heard some of these personal stories. We hear from families who have lost, one family we just heard from lost the father. 3 kids are now left without a father after taking one pill. What makes up this drug that is so incredibly powerful and deadly?
It's really unfortunate, the deaths that we have had, and the story that we're hearing over and over again is that people took 1 or 2 pills thinking that it was narco, and then they started experiencing difficulty breathing. Some of them had heart attacks, and it happened really fast. And what we have found with some of the pills that were retrieved, that were tested, is that they actually did not contain the components that you find in a narco pill. They contain fentanyl, which is 80 times stronger than morphine or heroin.
So what do you do? I mean, I know that laws have changed just over the past year. It's a lot more difficult to get these high-powered drugs, so to speak. I mean, you have to go back to your doctor each time before getting a prescription filled. It's making it a little bit more difficult for people to get their hands on them, especially if they are addicted to them. Right. Do you think that's pushing people to the streets more to still try to get this painkiller?
It's hard to say. We do know that a few of the individuals stated that they had a prescription, but they ran out and they could not get it refilled early enough, so they decided to get pills from friends or buy them off the street. I think the important thing is to realize that as we're making changes, as we're trying to look for ways of making it harder for the opioids to get into the wrong hands, is we need to look at those who are receiving them now and make sure that they get treatment if they have an abuse problem.
So if you're a family member and you know someone in your family who's taking something like this, what do you say to them? What do you do? How do you cut them off from taking these drugs, especially when that addiction is so strong?
It has to be done very carefully. It needs to be done by a professional. The advice is that they need to talk to their doctor about it, and then they come up with a plan to see how they can reduce the dosage. It's also important that for people who are taking these pills, that they don't resort to buying them off the street, because they could end up with a lot of problems.
Well, we appreciate you coming in. I know that there are a lot of numbers now to help folks. We've certainly put that on our website. Olivia Kasiri, thanks for being with us tonight.
Thank you for having me.
Edie, back to you.